Have you ever heard someone say, I am so obsessed about cleanliness, or I want everything perfect? Let's clear what actually OCD is and why it deserves more understanding and respect. Hello everyone, I'm Dr. Kashika Jain. I'm a psychologist. And in this video, I will make you understand what actually OCD is. OCD means obsessive compulsive disorder. It is a very common anxiety disorder. When a person suffers with OCD, they have repetitive thoughts. They have unwanted repetitive thoughts, and those thoughts are intrusive in nature. And these thoughts can appear in the form of images, repetitive urges, or in the form of word, or in any other form as well. But they are repetitive. So we call it obsession. And due to this obsession, they feel lots of anxiety. They are so fearful, they feel dread, total discomfort mentally, emotionally, and physically. And to release this discomfort, to feel more certain, confident, safe, they are bound to do some actions repeatedly. They feel like that someone is controlling their mind and they are bound to perform certain compulsions repeatedly. So those compulsive reactions we call compulsions. So when a person is in this OCD loop, when they are having repetitive thoughts and feeling lots of anxiety and bound to do some acts repetitively, it feels so distressing, so painful for a person who is really suffering from OCD. OCD is a very serious mental health condition because a person feels trapped. They feel confused. They lose their confidence. And whatever their brain is telling, they believe actually their brain. They feel if I'm having this thought, might be it is true. What if I don't do some action on it? What if it comes to reality? So because of that uncertainty, they worry more. Because when they feel that they cannot do anything about it, they are not able to face it. So in order to feel more certain, to protect themselves or their family members, they actually feel bounded to perform some rituals, some repetitive actions. And the more they do repetitive actions, the more trapped they feel because they reinforce their OCD. So in OCD, compulsions are the main problem. Unless you stop your compulsions, you reinforce your OCD. So how this cycle starts? They have a trigger. Trigger can be anything. Something they can see, hear, feel, touch, sense. Triggers can be external as well as internal. So whenever they have any trigger, because of that trigger, they have already some association and automatically some thought, some image comes in their mind. And because they are having this obsession, they feel more stress, more anxious, totally fearful. And they feel like that if they don't take action upon that, something is going to happen very bad with them or with their family members. And they do not want to experience that pain. So simply, to avoid that pain, to release that anxiety, they perform some rituals, they do some repetitive behaviors, and they feel less anxious. In that moment, that anxiety fades away. They feel less anxious, more relaxed. But this is temporary relief. Because again, this cycle starts. Because of their action, unknowingly they are reinforcing their OCD. They are making their OCD more stronger. And now every time when they take action, OCD becomes more stronger and this cycle keeps repeating. So, for example, like a person repeatedly washing hands just because he's fearful about germs, or might be he has fear of dirt. And he's so fearful. His mind tries to convince unless he wash his hands repetitively, his hands will not be clean. So, to gain that cleanliness state, as per his mind suggestion, he is repeatedly washing his hands, might be 2 times, 3 times, 10 times, and more than 10 times. And also, another example, if a person is so fearful about fear of loss, what if I don't check the door is properly locked or not? And in order to feel certain, in order to avoid that loss, that person is repeatedly checking the door is closed or not. And his brain is actually confusing him, and he is not able to catch those sensory clues that when he locked the door, actually he heard a sound, or he felt that grip when he touched the door handle, so he felt a grip, but his senses is not able to confirm that actually door is properly locked or not. He feels so confused, so lost in the thought, and feeling so fearful. So to release that fear, to release that anxiety, and to feel more safe and certain, he keep repeating this action. So these are few examples of OCD sufferers. OCD is really a very serious mental health condition, but now you are not supposed to worry because OCD is completely curable. Therapies like cognitive behavior therapy, exposure and response prevention therapy, acceptance and commitment therapy, and hypnotherapy are really helpful in treating OCD. Initially, when you start the treatment, you are able to manage your OCD, and gradually you cure from OCD. And that cure is permanent. You need to show commitment for your therapy sessions. You need to maintain a consistency in your efforts, because when you start your recovery journey, so initially for a few days, some days are good, some days are bad. But if you keep patience and continue with the therapies, so gradually you feel you are now stronger. Your OCD starts weaken and you become more stronger than your OCD, because you learn all those techniques, how to understand your obsessions are fake. OCD is narrating a fake story to you, and you understand it well. And when you understand that OCD is narrating a fake story, so you develop your power. And when you develop your power, you gain your strength. So you resist yourself. Instead of doing compulsions, you face those triggers and you stop doing compulsions, and you simply try to behave normally. And to release the anxiety, you adopt some relaxation methods. And in this process, IM technique is really helpful. IM technique stands for I means identify, that's OCD. A means allow that anxiety, sensation, urges, and M means mindfully connect to the surroundings and move on. And you gain your strength, and with the help of this IM technique, you control yourself and you stop doing compulsions. So in a way, you stop feeding your OCD. So your OCD becomes less stronger and you become more stronger. So keep in mind, remember, you are more stronger than OCD. You are not your thoughts. You need to remind yourself that I am having this thought, but I am not this thought. And this thought is not true. My brain is telling me a false story. My brain is trying to magnify this fear. My brain is now magnifying the uncertainty. I'm ready to face it. When you change your internal dialogues that, yes, I'm ready to face the uncertainty. So you gain your strength and you stop doing compulsions. Your OCD becomes weaker and you become more stronger. So CBT, ERP are really helpful. And likewise, ACT, acceptance and commitment therapy, is also very helpful. This therapy tells that if you are even having those thoughts, let them come, accept them, and channelize your energy into other areas, your values areas. Indulge yourself in those kind of activities, follow your hobbies which you like to do. So this way you channelize your energy into other direction and you don't feed your OCD. And when you stop feeding your OCD becomes weaker. So there are lots of helpful techniques of CBT, ERP and ACT. All these therapies are really very helpful. So I will definitely tell you in detail about those techniques in another video, but today I'm briefing you about those therapies. And likewise, hypnotherapy, it directly works on your subconscious mind. We put client into a trance-like state where client is not sleeping, not fully awake, but in a trance-like state where he is more open to receive the suggestion, more open for the changes. And subconscious mind is more powerful and ready to absorb new suggestions which are given to the client during the therapy process. So in the treatment of OCD, hypnotherapy is also very helpful because we do client specific therapy and we put very specific suggestion as per the client's need. So combination of all those therapies are really helpful to cure OCD condition, and likewise a balanced diet, regular breathing exercises and meditations and following a good lifestyle also are very supportive in fast cure. So by combination of all these therapies and following a good lifestyle, a person can easily cure OCD. So now stop worrying and take action, because now you are fully aware about that what OCD is and how a person suffers and what is a cure for OCD. So now you are fully aware. Now next step is to take action. Help yourself. So yeah, let me give you a very insightful information that I have my other channel in my name, Dr. Kashika Jain, where you will find more than 150 videos on OCD. Those videos are in Hindi. If you are interested, you can, on the subtitle, subtitles are available in more than 10 languages. So you can on the subtitles and you can watch that content also. Because in my Hindi channel, as I told you, that there are lots of videos on OCD and those are really helpful. They have been helping a huge amount of population, so you can take benefits as well. So coming back to this video, so to do OCD specific exercises, you can download my app from Apple Store and from Play Store as well. It is available in both iPhone and Android phone. So you can download that app, and app is available in my name, Dr. Kashika Jain, where you will find OCD specific exercises and follow that exercise routine as well for faster cure. So in the next video, I will tell you 5 biggest mistakes of OCD sufferers. If you found this video helpful, please do share it with other persons as well and help me to grow this channel. And do subscribe this channel for more updates. Take care. See you in the next video.